Hi everyone, today I'm here with a new topic, asthma. So let's talk about asthma. So before beginning, let us know what is asthma. Asthma is a chronic lung disease. So it's a chronic lung disease where inflammation and narrowing of the bronchi and bronchioles will happen. So definitely when there is a narrowing of the bronchi and bronchioles, it will consequently result in a low saturation level in the people. Now, the three key players that play an important role in this asthma, or we should know the pathology for that one. These key players are the main thing. That is airway smooth muscle that exists in our trachea and goes all down in the trachea, and its function is to constrict and dilate so that it facilitate the breathing. When asthma occurs, what happens? The smooth muscles will be constricted and the person will feel a chest tightness with difficulty in breathing. The second key player is that mucosal lining that is just below the smooth muscle in our lungs. This will be affected. As a result, the airflow will be decreased, which will result in coughing, wheezing, and air trapping. Remember the word air trapping. This is the key point in the NCLEX when the usually it will be asked a person can when a person verbalize I can't exhale fully, so you have to keep that point in mind. So then is the goblet cells. The goblet cells that are found in within the mucosal lining. They produce excess of the mucus to keep the bacteria and other infections out. When asthma happens, the person what happened the person will be having too much mucus production. So we know that when we have a too much mucus production, if a normal person also too much mucus is there, what will happen? They will be coughing, they will be wheezing, and air trapping will be there. So remember the key point, air trapping, when a NCLEX question is asked. So remember these things, asthma. Then is air trapping. What will happen when there is an air trapping? There will be compromised gas exchange, which will result in the low oxygen entering the blood, which will result in oxygen saturation will be decreased, carbon dioxide in the body will be high. So as a result, the person will be going into respiratory acidosis. So CO2 itself is an acid. So remember that thing. The triggers that will cause asthma. Some of the key points that we have to remember, that is an NCLEX question that are commonly asked, that is pollen, cool and dry air, exercise induced. So these questions you have to be alert. So the common triggers are pollen, smoke and pollution, dander, dust, mold, cool and dry air, respiratory infection, exercise, GERD, hormonal shift, beta blockers, NSAIDs, aspirin and sulfites. So remember the keywords pollen, cool and dry air and exercise. Now the symptoms are categorized into early, active and severe. The early symptoms are shortness of breath, wheezing, early fatigue, sneezing, sore throat, decreased flow best. So we will later deal in with what is decreased flow best. Then the active symptoms are chest tightness will be there. So I previously have explained what will happen when there is a airway smooth muscles will be constricted. So tachycardia, dyspnea, then decreased oxygen saturation that will be less than 90%, increased respiratory rates, and the severe symptoms go to rescue inhalers does not work for these people. They will not be able to speak out, just retractions will be there, and cyanosis of the lips and skin will be seen. Then coming to the treatment aspects, so the acute is the first, our management is the fast relief. So for that we will give bronchodilators, that is albuterol, nipratropin, anticholinergic drugs are there. Then we will go to long-acting beta-2 agonist, inhaled corticosteroids. Then we will provide the person high follows position. We have to continuously monitor the vital signs, assess for the cyanosis, especially of the color of the skin, and if there is a person is having wheezing, these things has to be assessed carefully. So always remember we have to start with the bronchodilator, then go to the corticosteroids. Now we will talk about what is peak flow meter. This is an important topic in the NCLEX. So peak flow meter, it is a device that will tell how the patient's asthma is. When it is used for the first time, it is considered as a personal best. That is how much effort the person is able to do here. So how it is used? It is exhale into device 2 times per day for 2 to 4 2 to 3 weeks. The highest reading is considered within that time frame. So the color, it is categorized into color zones. If it's green 80 to 100%, that means the person is doing his best. If it's yellow 50 to 80% of the personal best, that will need, the person will need mild inhalers. But we have to be careful if there is a narrowing of the airway. It is an warning sign. Then comes to the red zone. If it's less than 50% of the person's best, then it is a medical emergency. The management has to be done immediately.